Hi, in this video we will talk about that 40 million kidney patients can heal naturally if they do this every day. First off, let's talk about hydration. Drinking an adequate amount of water each day is crucial for kidney function. It helps to flush out toxins and waste products, keeping your kidneys happy and healthy. Next, let's focus on a kidney-friendly diet. Foods like leafy greens, berries, fish, and whole grains are excellent choices for promoting kidney health. They're packed with nutrients and antioxidants that help to reduce inflammation and protect against kidney damage. In addition to hydration and diet, regular exercise is another key component of kidney health. Getting your body moving helps to improve blood flow and circulation, which can benefit your kidneys in the long run. So aim for at least 30 minutes of physical activity most days of the week to keep your kidneys in tip-top shape. Number 1. Add lemon juice to green tea. Packed with vitamin C and antioxidants, lemon juice boasts anti-inflammatory properties crucial for kidney health. Its natural acidity aids in dissolving kidney stones, potentially preventing painful blockages. Lemon juice promotes hydration, essential for flushing toxins from the body and supporting overall kidney function. Combining lemon juice with green tea enhances its efficacy, creating a powerhouse beverage for kidney health. The acidity of lemon juice complements the earthy tones of green tea, resulting in a refreshing and invigorating blend. Number 2. Reduce phosphorus. Phosphorus is a vital mineral involved in various physiological processes, including bone formation, energy metabolism, and cellular function. In individuals with kidney disease, impaired kidney function leads to difficulty in excreting excess phosphorus, resulting in elevated levels in the bloodstream. Certain plant-based foods contain compounds known as phosphorus binders, which help prevent the absorption of dietary phosphorus in the intestines. Incorporating phosphorus-binding foods such as whole grains, legumes, nuts, and seeds into your diet can aid in phosphorus management while providing essential nutrients and fiber. Number 3. Improve body antioxidant. Antioxidants are your body's frontline defense against oxidative stress, a common culprit in kidney damage and disease progression. Incorporating antioxidant-rich foods into your diet is crucial for maintaining optimal kidney health and supporting the body's natural healing processes. Consider incorporating supplements such as vitamin C, vitamin E, selenium, and alpha-lipoic acid into your daily regimen under the guidance of a healthcare professional. Be mindful of dosage and potential interactions with medications, and always opt for high-quality supplements from reputable brands to ensure safety and efficacy. Number 4. Garlic. Garlic has been revered for centuries for its potent medicinal properties, earning its place as a culinary and therapeutic powerhouse. Rich in sulfur compounds, antioxidants, and anti-inflammatory agents, garlic offers a myriad of health benefits, including cardiovascular support, immune enhancement, and yes, kidney protection. Garlic's antioxidant content scavenges harmful free radicals, protecting delicate kidney tissues from oxidative damage and supporting overall renal function. Garlic's anti-inflammatory properties can help alleviate kidney inflammation and reduce the risk of further damage. Number 5. Drink water. Water plays a critical role in flushing toxins, waste products, and excess minerals from the body, preventing the formation of kidney stones and reducing the risk of urinary tract infections. Dehydration can strain the kidneys, impairing their ability to filter blood effectively and increasing the likelihood of kidney damage and disease progression. Aim to drink at least 8 to 10 glasses of water per day, or more if advised by your healthcare provider, to ensure proper hydration. Spread your water intake throughout the day, sipping gradually rather than consuming large quantities at once, to maintain steady hydration levels. Number 6. Vitamin D. Vitamin D is not just a vitamin but a potent hormone essential for numerous physiological processes, including bone health, immune function, and cellular regulation. Adequate vitamin D levels are crucial for maintaining optimal kidney health, as the kidneys play a pivotal role in converting inactive vitamin D into its active form, which is necessary for calcium absorption and mineral balance. Vitamin D supplementation has shown promising results in improving kidney function, reducing proteinuria, excess protein in the urine, and mitigating the progression of kidney disease in patients with various renal conditions. Adequate vitamin D levels are associated with a lower risk of developing kidney stones, urinary tract infections, and other complications commonly seen in kidney patients. Number 7. Magnesium. Magnesium is an essential mineral involved in over 300 biochemical reactions in the body, including muscle and nerve function, protein synthesis, and blood glucose regulation. Adequate magnesium levels are crucial for maintaining optimal kidney health, as magnesium plays a key role in regulating electrolyte balance, supporting blood pressure control, and preventing kidney stone formation. Magnesium supplementation has shown promising results in improving kidney function, reducing the risk of kidney stone recurrence, and mitigating the progression of chronic kidney disease. Magnesium's vasodilatory properties help relax blood vessels, promoting healthy blood flow to the kidneys and reducing the risk of hypertension-related kidney damage.